Certainly as conservatives, we want to make it very, very clear that there's a failure of leadership in this government in being prepared for the pandemic and the unfortunate circumstances that have continued to persist throughout the pandemic. The problem here, of course, is that we have lost 30,000 lives in Canada, which is also comparable to the 42,000 Canadians who died during World War II, in which we mounted a massive effort for change. This government has not done that, and this failure of leadership has left the provinces only with the ability to have lockdowns as their primary method of treatment. So the unfortunate thing is that's what we're left with as Canadians. So Minister Duclos, I have a few questions for you, sir. Before the pandemic began, acute care bed occupancy, according to the OECD, in Canada was 91.6%. Only 2 countries were worse. Are you aware of this problem, sir?
Thank you, Mr. Chair, and thank you, Member Ellis. I also share the knowledge and the sadness of these 30,000 people having died. This being said, because of the hard work we did together, we avoided the situation that we saw in many other countries, including in our southern border. Now, if we had the same death rate as in the United States, we would have ended with 90,000 death rates, and that's a tribute.
Yes, sir. I understand that.
That's a tribute to the hard work, including the vaccination hard work that we've done over the last few months. I would like to congratulate and thank everyone that got vaccinated in the last few months, and everyone that did the work to get those people vaccinated.
Sir, I asked you a question very specifically, and this is answer period, not question period. Were you aware that the acute care bed occupancy was 91.6% in Canada in pre-pandemic days?
So 2 things on that. The first thing that we know is vaccination is going to remain the key. We want people.
Sir, I don't think I asked you anything about vaccinations.
The second answer is that we have provided $63 billion exactly for that purposes of increasing abilities and capacity in our healthcare units, including the ICU units, obviously.
During the election campaign, your party promised to hire 7,500 new physicians, nurses, and nurse practitioners. And how many of these have been hired since the election, September 21st?
We have indeed promised a total of $25 billion additional to what we have invested during COVID-19, which I repeated, about $63 billion just to protect the health and safety.
Just the bodies, sir, not the numbers, just the bodies.
That involves a total of about $6 billion for primary care access to a family doctor, $7 billion to try to,
how many have been hired, sir?
All that.
How many of the 7,500 have been hired? 7,500 people, how many have been hired? Simple question.
Let me be even more clear. $63 billion invested until now, with obviously thousands of nurses and doctors being paid and being recruited and being provided with the appropriate care that they need.
Sir, how many new hires since September 21st that your government promised?
So $63 billion, that's obviously of great substance and great value to
that's not bodies.
Colleagues, and they've been able to not only to recruit, but to maintain, and equally importantly, to provide the working conditions that they deserve to look after so many others.
Those are people that are there, sir. Is it fair to say that you do not know how many people have been hired that you promised?
So not only are these people being looked after, because they need to look after so many others. And that's why we were so pleased to add another $25 billion in our campaign to make sure that those significant investments would continue over the short and the longer term.
Yeah, I guess you're just refusing to answer my question. I appreciate that. Do you know that the emergency room wait times in Canada are the worst in the OECD? And do you have a plan to change that, sir?
So not only do we obviously keep increasing and investing through the Canada Health Transfer, but we've also added another $11 billion just a few years ago to look after the mental health and the home care services that seniors and many others across Canada need. We've added another $63 billion during COVID-19 to look after the emergency healthcare needs that the provinces and territories are faced with. And we are adding more resources as we exit from the crisis and eventually repair the damage that the crisis has created.
Do you know how many ICU beds we have in Canada, sir?
So I would tell you that differs obviously across provinces and territories. And that has been sustained, fortunately, because of the strong collaboration between provinces and territories and the federal government. I've had 6 recent meetings with my health ministerial colleagues. Now, this is an important way to collaborate together and to look after the needs that so many across Canada are feeling right now in the current crisis.
Sir, are you aware that Canada has the lowest number of hospital beds out of 29? We ranked 29th out of 33 states of the OECD. Are you aware of that, sir? Simple yes or no answer. Simple yes or no would be great.
We are aware of 2 things. First, not only was it a challenge before COVID-19, but obviously that challenge has been increased during COVID-19. That's why we're continuing our efforts with provinces and territories, not only to exit from COVID-19, which is the key priority now, but as I said earlier, to repair the damages created by the crisis.